We continue with our interviews during the International Thoracic Symposium 2019, and together with me is Professor Calvin Ing, and we're going to discuss how we can diagnose and treat lung cancer in a very early stage. How can we do that, Professor?
Thank you very much for this interview, and it's a pleasure here in Milan to be in this international symposium. My topic today really is about doing a one-stop, one-shop strategy in trying to diagnose and treat early stage lung cancer. Because I think with the screening that a lot of countries are adopting, and also more awareness from physicians, we're seeing more and more small lesions and early lung cancer being seen and small nodules being seen. The strategy that we are taking in my institute in Hong Kong is that we try to sort out the diagnosis and staging and treatment of these patients in one setting or in one go. And we've adopted this by using the hybrid operating room. So in the hybrid operating room, we have a cone beam CT and high-end imaging facility that allow us really to use other tools to take samples from these very small lesions very accurately to get a very early diagnosis in the same setting, and then to provide treatment, for example, surgery, or even more new forms of treatment like ablation in this image-guided operating theatre suite.
So it's very interesting about that. And is it possible that there are some obstacles that we cannot diagnose, that this is an early stage lung cancer?
Yes. Although we have all these high technology and these high definition imaging capabilities as well as navigational capabilities to reach these lesions, small lesions in terms of the diagnostic yield is still relatively low. So it depends very much on the lesion size and the composition. So for small lesions, only a couple of millimeters, in fact, even with all of these technology, your diagnostic yield would not be very high. And the other problem that we have, and I suspect all throughout the world, is the ability of the pathologist, in fact, to give you a diagnostic call or to give you a report in a very short period of time. And that depends on the quality of the biopsy that you take, and also the amount as well as the lesion type. Yeah. So in Asia, for example, we see a lot of ground glass opacities, and they're notoriously difficult to diagnose by the pathologist because the number of cells that we get out from these lesions, despite the best biopsy techniques, could be limited. So there are areas in this approach that can be improved in the future.
Okay. Thank you very much.